Great. Hi, everyone. My name is Nicole Bahina, and I'm with All Chicago, the Continuum of Care Agency. And thank you for joining us today for our COVID-19 update from the Homeless Service Division, together with the Continuum of Care. You'll hear from me today on behalf of All Chicago, some folks from DFSS and CDPH, and I'll let them introduce themselves as they're speaking today. But if we just want to go through a few housekeeping slides, next slide. Our housekeeping. Everybody's on mute, so nothing's changed if you've been joining us. We're just going to continue using the chat tool to submit questions. Please notify us of any technical issues. We do have a team of people at All Chicago who are helping troubleshoot along the way. And worst comes to worst, you can try to switch the way that you're joining for audio or just log out and log back in. But let us know if you're having any trouble by using the chat box. And I'll turn it over to Maura to lead us through the agenda and start the city's section.
Hello?
Great. This is Maura McCauley with the Department of Family and Support Services. I'm the Deputy Commissioner for Homeless Programs and Domestic Violence Programs. Thank you all so much for joining us. Our agenda this Friday is very similar to our past agendas. We will continue to share progress from CDPH on our overall COVID mitigation strategy within our homeless system. We'll provide additional updates on the city's COVID-19 response for individuals experiencing homelessness. And then All Chicago will be providing some updates related to efforts through the COC and HUD, and we will continue to make time throughout the presentation and at the end of the presentation to answer questions and get a sense of what real-time needs are from our community of partners, especially those of you on the front lines who are really just doing a tremendous amount of work. So things that we can't get to or don't have answers to at the moment, we are tracking and trying to continue to provide information in between webinars through the different resources we have available. But certainly your questions help us inform the tools that we need to develop and webinar topics from week to week. Next slide. You can go to the next slide.
Okay. Hello, good morning, everyone. Are you able to hear me?
Yeah, we can hear you, Dr. Jasmine.
Okay. To any newcomers, my name is Dr. Jasmine. I'm a medical director over at the Chicago Department of Public Health. We usually start by giving an update on the current status of COVID-19 here in the city. You can find this data. It's available on chicago.gov/coronavirus. As of yesterday, there were a total of 15,399 cases of people who were diagnosed with COVID-19. And of those cases, there were 661 deaths. This is an increase in almost 1,000 cases and 34 deaths since yesterday. Yesterday there was also an announcement by the governor for the extension of the stay-at-home order with some modifications. This is all in the effort to continue to what we call flatten the curve, to slow down the rate in which people are diagnosed with COVID-19, also that we can avoid overwhelming the healthcare system. Okay, next slide. And this also has been referenced before in previous meetings, the community mitigation strategy in partnership with DFSS, CDPH. We have three broad areas in which we're trying to respond to COVID-19 pandemic. There's a prevention aspect, identifying cases, and also responding once those cases are identified. In terms of prevention, we've developed some general guidance and screening tools for shelters and outreach workers to use. These are available on the website if you're not familiar with them. And we, even at the beginning of this pandemic, DFSS really has done a great job in decompressing the shelters to help implement the social distancing recommendations that the CDC has provided. There also has been personal protective equipment and thermometers that have been provided to shelter staff and outreach workers. And then we've also established supportive housing for people at high risk for hospitalization if they were to contract COVID-19. So these high-risk groups, we're still in the process of, we've identified them, but we're in the process of moving them to this supportive shielded housing. Most of the shelters have been approached. I understand there are about 3 or 4 more. We have daily calls to give us updates. We're working in conjunction with Lawndale Christian Health Center. They visit the shelters and do a closer assessment of those who are at high risk, and then once they're identified, we do our best to move them into this shielding housing. When it comes to identifying those who are COVID positive, we're trying to make clinical screening and testing available for shelters and outreach workers. If we do learn of a COVID positive case at a specific location, we've been sending our clinical investigation team and rapid testers to provide testing in areas in this congregate setting where everyone's at increased risk of contracting COVID-19. We obtain the tests, and then once the results are available, if it's necessary to move any positive cases, we would try to find isolation housing. If a particular shelter is able to set up an isolation area, we provide support through our nursing staff to go to make sure that the isolation room is appropriately set up and that appropriate infection control measures are made. We prioritize our investigation by basically the number of cases we're aware of that are positive in the locations, and the nurses actually going to visit each shelter is part of this tailored guidance. All of the shelters should have been visited by a CDPH sponsored nurse by now. If not, please let us know. In terms of response, we enable shelter and outreach. We have a referral-based system for quarantine and isolation. I'll get more into that later on today. And we are working to activate we actually have a center for providing services for those with behavioral health needs, and we're looking to expand that very shortly. Next slide. And so here are the options we have for quarantine and isolation housing. If you go to the website listed on the bottom of the page, you'll find an expanded details of all of these solutions. One is the McCormick Place Alternative Care Facility. There are exclusion criteria, and it's listed on the web page. And for this facility, it's meant for COVID-positive individuals who are transferred from hospitals, but who have not completed the minimum isolation period. So these are directly from hospitals that they're considering taking. The supportive isolation facility for this option is a congregate setting for COVID-positive individuals experiencing homelessness or unstable housing. They're usually stable for discharge, but they need additional time to complete their isolation period. So we require, for this group, if they require additional medical support or if they have behavioral health needs, they would go to this option. You may be familiar with a safe haven, so that facility would fall under this category. There's another facility that should be opening soon, and we'll announce it when it's actually available. So that's why we're using this broader category for when we have multiple options. And then the third option, the private general isolation rooms. This is meant for individuals who lack an appropriate setting to self-isolate, and if they don't require additional medical or behavioral health support. For the second two options, the last two options, a central intake form is required to be filled. The form is found on the website listed on the bottom. Also can access it through our alert, chicagohon.org/COVID-19. The form is required. It's a referral form, so people cannot self-refer. And it asks several questions. If it's from a healthcare facility, it would require the medical information to be filled, but it's also possible for shelters to refer individuals on this essential intake form as well. Next slide. And here's a peek of what it looks like. Here is basically the first page of the form, and the information that it requests of you depends on what facility you're calling from. So if it's a healthcare facility, the subsequent questions might be a little bit different. We try to make it shorter and more easier for homeless shelter personnel to fill, because you may not have access to all the medical records. And so the transfer criteria, the person must be confirmed COVID positive, and if they're unable to isolate within a congregate setting. We've had some cases from hospitals where patients who were being discharged from the hospital who were seen for reasons other than COVID-19, some of these hospitals were trying to use this form, but this is specifically for those who need to complete their isolation period after being diagnosed with COVID-19. There are some exclusion criteria. It can be found on the website. And then we ask that for every question that comes up on your screen that you've completed in full. There are some questions where it won't let you submit it if it's not completed. And even if it lets you submit it, and if there's some areas that are blank, it slows down the processing time, because then our reviewers would need to contact whoever filled out the forms to fill that information. And sometimes whenever that callback occurs, we've noticed that sometimes people don't always respond right away, so that delays making a final determination. If there's any issues with a client being transferred, our email address is still the same. You can use coronavirussocialwork@cityofchicago.org. Next slide. Things are constantly changing and evolving when it comes to COVID-19, and CDC as well as CDPH. We're constantly updating our websites to make sure that the public is informed with these updates. Recently, the CDC updated their shelter guidance. This was just a few days ago, and you can view the more complete guidance on the website listed in the upper right-hand corner. Some of the key areas that they talk about is that they want to highlight necessitating applying a whole community approach, meaning using partners across all sectors, outline clear roles and responsibilities. I think that's due to just for the very nature of how we learned about the COVID-19 and how it spread. We've had to act very quickly. and it's very hard. It's been very hard to communicate the changes as they occur in real time, and so they felt it to set this as a reminder for everyone. There were also considerations for facility layout. So they talked about the use of barrier, bed spacing, meal service, isolating and cohorting symptomatic versus untested clients, and confirmed cases. These are things we've talked about in the past before. Barriers in terms of intake desks, just to make sure that if staff is protected whenever a new client comes in and is being assessed. Bed spacing, social distancing at 6 feet, and sleeping head to toe to maximize the amount of space between each client. In terms for meal service, it's about spacing out, if possible, the different times and limiting the number of people who would eat at the same time. And then, if it's possible, designating an isolation area in your facility and having a plan for what to do if someone does become symptomatic. How do you get them to care? Do they go directly to the isolation area? And how to report it to CDPH. There's considerations for facility processes. So identifying high-risk clients, using cloth masks, maintaining normal operations, limiting visitors, and establishing medical behavioral health partnerships. So I know DFSS has been very good about reaching out to all the partners to use the screening tool to identify high-risk clients. I ask that you all maintain a list of who those clients are. Our nurses should have visited you by now and should have obtained this list. If not, please let us know. This will help us provide shielding housing for those high-risk clients as they become available. When it comes to the use of cloth masks, so this is a bit different now for the shelter guidance. They're encouraging the use of cloth masks. Before it was just with the clients, but now also with the staff. The same rules still apply when it comes to touching the cloth mask. Make sure that hand hygiene is completed prior to removing or placing it on, and then afterwards. The whole idea is to avoid touching your face, so secure it in a way that doesn't require frequent adjustments. Maintaining normal operations, this is an essential need. Thank you so much for all the efforts for maintaining as much as possible staff coverage to keep your shelters open. We ask that you limit visitors to the shelters. And then in terms of medical and behavioral health partnerships, we are working to link each of the shelters with an FQHC so that if there are medical questions that come up, you have the support. We did an initial round with our nursing, but we want something that's more long-standing because we know issues may arise after our nurses leave. For asymptomatic infections, it showed, even with some of the testing that we have done, we already knew this, that there could be many asymptomatic clients, meaning they're not coughing or sneezing, they don't have a sore throat, they're not short of breath. So there are many people who've been found to be positive with COVID-19 without any of these symptoms. And it's just some of the guidance reflects that, just so you're aware, that is a possibility. And for the facial covering versus medical grade PPE, the cloth mask should be used by both clients and staff when in communal areas and should be regularly laundered. The same thing applies. If you're removing the mask, make sure that the exterior surface of the mask is placed on a clean piece of paper, if possible. The part of the mask that was in contact with your nose and your face should be face up, so it doesn't get contaminated with whatever surface you place it on. And then we ask that PPE is reserved for staff who are screening and caring for sick clients, or for those who are disinfecting the environment. Just a reminder that frequently touched surfaces should be disinfected. So like the door handles, light switches, keyboards, tables, anywhere where many people are touching on it throughout the day should be cleaned, if as close as possible, at least 3 times a day. And then cloth masks are not substitute for PPE. And so if you are dealing with someone who is who's sick, or if you're disinfecting the environments, you should not be using a cloth mask. You should be using a surgical mask. Next slide. So the testing, the rapid testing that we've been doing has been in partnership with Rush University and UI Health and other organizations such as Heartland Health Alliance to provide support. So they would come in with a team to test the clients in the shelter, and the results have been coming back more quickly. Initially, results would take about a week, 4 to 5 days for it to come. Now we're getting results as soon as 24 hours. Sometimes it might take up to 48 hours. And the rapid testing teams have been deployed to congregate settings that are experiencing outbreaks, meaning if there are several clients who are positive, we want to make sure that we know exactly who in that setting is positive versus negative, so we know how to isolate them appropriately. And so for those when we do know there's an outbreak in a location, both symptomatic and asymptomatic people are tested. And that's how we know that asymptomatic people, there is a possibility of them also being positive for COVID. And then we provide guidance that's tailored to the specific setting. We review the general guidance, but then also show you how to apply it to your setting. As of the 18th of April, more than 1,000 individuals have been tested. Right now, we're moving into the next phase of testing. So we're trying to target sites that haven't had any active outbreaks. And as testing capability becomes expanded, we're trying to increase the number of tests we're able to complete per week. We're currently aggregating the testing data, and once complete, the data will be available on our website, and we'll alert you to when it's posted for all these tests that have been done. And just to remind you, anytime there are 2 or more cases in a location, we ask that you report it to our website on a reporting form. If you go to chicagohan.org/COVID-19, you'll be able to report it there. Next slide. And then for the nurse visits, as of yesterday, 56 programs across 46 facilities were visited. There are a total of 42 nurses and PAs from Favorite Healthcare Staffing. We trained them, I think it was last week, and prior to them coming out to visit the facilities. This was basically to go over our guidance. We also had them walk around to assess infection control practices, and then to assist with any implementations or tweaks that may have needed to be done. We assisted with the count of high-risk individuals, and so that list of high-risk individuals, we ask that you share them with our nurses, so we are aware of who the individuals are, and provided telehealth screens Previously, we were using MRCs. That hasn't been used as much as we thought. Initially, when we first brought it out, we thought there would be more usage. So we heard your need that you wanted more in-person consultation, and that's why these nurse visits were set up. We also documented any concerns that the individual shelters had, and they brought all these concerns to us. Some of the common concerns that we've heard, is there a behavioral health outreach team that can help for cases where an individual, due to the COVID pandemic and being asking them to stay in place, that may be anxiety provoking or just increasing the symptoms that may have previously been controlled. We know that we're asking for more support for behavioral health. The common concern also with asking for more PPE, and then also linkages to dedicated clinical support. So we're working on that. We're trying to connect every shelter with a FQHC that would provide that clinical consultation. All visits and phone screens were documented in standardized form, and the reports are currently being compiled and analyzed. So thank you so much for those who participated. We've heard many great things from our nurses when they came back daily, Thursday, Friday, Saturday, and Sunday. We had daily huddles for the nurses to talk to us and give us some feedback about what they've been seeing at the shelters, and most of it was very complimentary. So thank you so much for partnering with us and actually implementing the guidance. Thank you for providing this feedback. And then the results from all of the feedback, it will help inform any of the procurements of supplies and requests for staffing assistance. So more to come in the upcoming days. I think that was my last slide. Can I see? Yeah. So do you have any questions?
Thanks, Dr. Jasmine. This is Maura again.
Mm-hmm.
There were a few questions about folks who want to try to reconnect.
Mm-hmm.
So I'm just going to talk about follow-up that we're doing with shelters about,
okay.
And then we'll go into questions. So if you were trying to connect with a nurse or they reached out to you and you didn't connect for any reason, DFSS has a list. It's just a handful of providers who either indicated they didn't need the visit or didn't connect with a nurse. So our team should be reaching out to you today to make absolutely sure that you're fine. So I can just read out the names of the shelters that we're doing additional reach out to just to make sure you're all set. That's the Night Ministry, one of the Thresholds facilities, Helping Arms, Puerto Rican Cultural Center, Amani House, Primo 4, Alexian Brothers, eHark with Salvation Army, and then Wings Metro. So you'll be hearing from us today, and if you do still need assistance, we'll be working with CDPH to figure out how we can either reconnect with the favorite nurses or another resource. Okay, so now I'll go over to questions for Dr. Jasmine. One of the questions is whether clients without ID or insurance are able to access testing.
So if the testing team comes to the facility, we don't require ID. There should be a way that we should verify the names, but I don't think that's been a problem so far. In terms of going to a hospital, I don't think, usually for registration purposes, but if it's an emergency, I don't think they require ID.
Okay.
Mm-hmm.
Is there a testing strategy for encampments? If a street-based individual tests positive, are efforts made to determine if that individual is living in a specific encampment? And then I think the follow-up to that is generally, how would somebody who is street homeless access a quarantine or isolation facility if they did test positive?
Yeah, so I know encampments are included in our outreach efforts. I would have to get back to you next week when I would have to speak directly to the investigation team to tell you the exact specifics about the encampments. I do know they've been identified, though.
Okay, great. So we can maybe add that to our topic for next week or get something out there. Our Is there any reason you would recommend isolating a new client who moves into a facility that has had a stable and non-symptomatic population? And if so, for how long?
Oh, so no, because usually we have that initial screen, but we haven't. There's no official recommendation to isolate new clients as they enter the facility.
But if they have symptoms, they would.
If they have symptoms, yes.
Okay.
So if they do have symptoms, you would isolate them for 7. You could presume them positive. You could report it to us, but usually it's the 7-3 rule. So 7 days of isolation with the final 3 days being afebrile without any medication.
Okay. If our congregate setting is so far without active outbreaks, will we still be contacted to set up on-site testing? So I think this is around the testing strategy.
Yes, I believe so. So because there are a limited number of tests that could be completed per day, it will take a few days, but you will be contacted.
Okay. Can you please clarify which would be an appropriate referral for a COVID positive patient who is asymptomatic? This person said they've been having issues with referrals out of their ED, where the social worker is bounced back and forth between 311 and the quarantine program.
So COVID positive individuals, if they haven't completed their isolation period and there's no isolation area in the shelter, they should be going to one of our facilities. So if it hasn't been 7 days since they were last diagnosed, they should be going to either our supportive isolation or individual room isolation. So have they been trying to directly send them to the shelter?
I'm not sure, but just to clarify, then the process to refer into the isolation program is through the central intake process that you
the discharge person should be going to the website that I had listed, and there's the central intake form.
Okay. So I think this is a follow-up question to one I just asked you, but by not isolating new clients, is this an issue given that we know there are asymptomatic carriers? So introducing a new client. Go ahead.
Yeah, so I think that's the idea behind going around to test each of the facilities, because you can't really tell if anyone truly does not have COVID-19 if they're not symptomatic. So if you're saying that your clients aren't symptomatic, it doesn't mean there aren't any other asymptomatic carriers in the group.
Okay, so testing is going to help continue evolve the process within the shelter system. Okay. There's some questions about testing sites. Are there any other locations doing COVID-19 antibody testing besides 2400 North Ashland?
That I don't know off the top of my head, but I do know the Illinois Department of Public Health, on their website, they do have a list of locations that are providing the tests.
Okay. And then I know you mentioned the partnership of providers who are coming in to test through CDPH. Do you know if there are any testing sites that will come out to shelter facilities to test residents and staff?
So it's part of the rapid testing team, so they will be coming around. It depends on whether it's sponsored by Rush or UI Health, but that's when the testing will occur. The partnership with the FQHC or community mental or community health center is more for if questions come up after or even before the testing arrives.
Okay. And then when you're coming, will the rapid testing at the shelters include staff as well as shelter residents?
Yes.
Okay. And then another question is whether drop-in centers who are also working with individuals who are experiencing homelessness and maybe, you know, unsheltered or in unstably housed living situations, do you know if they are being included in the testing strategy?
Are they on the list? I'm not.
We
sure.
can.
Yeah.
That I think that's a good follow-up for us to make sure that the sites are part of that strategy. Okay, I am just going to take a moment. I know the team is quickly dropping in questions, so I'm just checking to see if we're through with CDPH at this point. I think that we've covered everything, Dr. Jasmine, that we've received. So if we do get additional questions, we'll make sure to follow up in between webinars.
Okay. Thank you.
Okay, thanks so much.
Okay. I'll speak to you shortly.
Great. Okay. We can move on. So I will move on to talk about the DFSS portion of the city response. We continue to open temporary shelters to allow for the decompression of the shelter system. In total, we plan to establish 700 beds. So far, we have 4 temporary shelters online, you know, providing roughly 500 beds for single men, women, youth, and returning citizens. Our Croc Center temporary facility will shortly be accepting families. And I saw a question in the chat about family composition being accepted, and we are working through that with our partners to make sure we're all on the same page about family composition accepted at the Croc Center. So as soon as that's confirmed, we will make sure to notify everyone through the Slack channel and other ways. And Catholic Charities will obviously have that information for placement purposes. We are also working with our EOC, the city's Emergency Operations Center, to bring on additional facilities for people experiencing homelessness, including COVID-positive individuals. And I know CDPH referenced that, and more information will come about that as it's coming online. We are also in the process of working to open another temporary shelter facility within the next week to 10 days to provide 200 beds for single men and women. So I think it's really important to emphasize that our efforts to decompress shelters within our existing system meant that our shelter system, our existing shelter partners in order to implement social distancing, especially in the congregate sites, to allow for beds to be spaced 6 feet apart per CDC guidelines. It meant that we reduced the number of beds in our current shelter footprint. So all of these additional facilities that we are opening up are getting us back to our current, our existing shelter bed levels. At this point in time, we haven't been adding new beds, but that is something that we are continuing to monitor on a daily basis with the requests that are coming in for shelter, with things that we're hearing from our partners about the need. We're also looking at movement as the shelters are having more positive cases and people are moving into isolation facilities, and the work to identify high-risk individuals moving into hotels is happening. We're constantly evaluating that need and what the ongoing need for the different types of spaces is going to be for the duration of the COVID crisis. Next slide. DFSS is extremely grateful to our partners at Lawndale Christian Health Center and CDPH for supporting shelters in relocating supporting them in placing clients from congregate shelters who are a high risk, so who are around the age of 60 or with underlying health conditions. This effort continues this week. Shelters have been wonderful in identifying by name who those individuals are in their shelters, and then we are working every day in coordination with CDPH and Lawndale Christian Health Center to work on the additional screening and transfer of those residents. Shelters also should have received an email from if you're a DFSS funded agency, you hopefully received an email from us this morning alerting you that additional funding is now available for COVID response, including, replacement staffing, hazard pay, and additional materials and supplies related to either expanded operations if you, for example, expanded from overnight to a 24/7 operations, and just in general, all of the increased needs that our providers are having to support this COVID response. This funding also includes, we're so grateful for the support from IDHS through the funds that they've made available for emergency lodging funding, which is being administered by All Chicago. So this has been a collaborative effort to make sure that we could identify resources to support all of you throughout this crisis. So again, you'll be notified by DFSS about your specific funding amounts, both from us and for the IDHS funds that are coming through All Chicago. Next slide. So just a reminder that calling 311 is still the process for connecting clients to shelter. Again, the only adjustment, that is in place at this time is that there has been an additional question added that will ask 311 operators will ask the caller if they've been recently released from jail or prison, and this allows Catholic Charities to quickly identify if the person requesting shelter should be connected to resources for returning citizens. We continue to work through and help troubleshoot the ongoing issues that we are hearing about related to accessing shelter through 311. We've had many conversations, I think all of us from the city side of things, and I know our colleagues at Catholic Charities are equally committed to making this process as smooth as possible to make sure people in need of shelter are getting access to that quickly when we have beds available. So we're just asking you to continue to help us improve this connection by reporting any issues you have via the DFSS homeless email address. I our team talks about these every single day on a daily check-in that we have. So I know that many of you are doing that, and just know that we are continuing to monitor and elevate those and working with our partners to improve where we can. 311 is just inundated because of the crisis, and so they are clearly aware of the challenges that are being experienced citywide in general for all of the responses, but they're coming to the table and working with us as well. What's really important and helpful is that if you are able to give a date and time and the person that you spoke with, that helps us get to the bottom of things a lot faster. But even if you don't, continue to report the issues, and we will take those and help us improve our response where we can. Next slide. So just a reminder that Catholic Charities continues to complete the CDPH health screener by telephone for all shelter placements. So if Catholic Charities does provide the transportation, they are also doing the health screener when they transport. So if they provide the transportation, the shelters will receive the health screener and the regular Catholic Charities intake form. If the other vendor that is supporting Catholic Charities with transportation, SCR Medical, provides transportation, you will continue to receive a modified intake form and no health screener, but keep in mind that the health screener has been conducted over the phone. We continue to require that shelters continue to follow the CDPH protocol and perform the screener at intake as well. This is the way that we are able to make the best decisions as a system to isolate people if needed, if they do have symptoms when they come to you. And the teams are making every effort to transport only residents without known COVID diagnoses, but this protocol is really important at both ends of the process to support the health and safety of everyone involved. And we know this is a process that is going to continue to evolve. We've been having conversations with several partners about, getting access to thermometers and helping providers who maybe aren't yet doing temperature checks. Those things that may become part of the evolving process for this protocol. So we'll continue to update that as that changes. Next slide. For the work with people who are unsheltered, we continue to enhance 24/7 outreach on the CTA, a partnership of several outreach partners, including Threshold Salvation Army, Featherfist, Haymarket, and we know the Night Ministry is out doing a ton of this as well, and we're so happy that we are now tapping into their efforts to have a comprehensive response. But we have been doing scheduled targeted outreach that started on Tuesday of last week. We're talking and partnering with CTA officials about, how we can an increased effort to provide education to individuals who are riding the CTA and who are homeless about COVID-19, trying to offer them face masks, and then again created an expedited procedure for our outreach teams to connect clients who would like to go into shelter through Catholic Charities. Outside of the CTA, we continue citywide canvassing efforts where outreach teams are screening for risk factors, providing connections to food and water. We are continuing to maintain hand washing stations and porta potties. And we also thank our partners for continuing to update on the needs for servicing of those resources. We are continuing to work with our Emergency Operations Center to ensure that those hand washing and porta potty stations are serviced on a regular basis. So if you do get word that they need to be serviced, don't hesitate to reach out. We need all eyes and ears to help make sure that those are working and functional during this crisis. Next slide. So we continue to ask our shelter programs to please update Catholic Charities about changes in your bed availability. We understand that won't necessarily be frequent, but as I mentioned earlier, we are tracking all available information to help us understand need for, different types of shelter or lodging settings based on the evolving need of the crisis. We know that beds are in great need, so the more Catholic Charities knows about your bed availability, the more likely we are to connect people when we do have beds available. And this also goes for family shelter programs. This is a change. Normally family shelters are reaching out to Salvation Army with their updates about bed availability, but for the duration of this crisis, Catholic Charities is managing the bed availability for all shelters. So please let them know. Continue to keep DFSS informed about any staffing shortages, changes in your bed availability, and if you have suspected or confirmed COVID cases or any other issues and concerns via our DFSS homeless email. Obviously, if you have, COVID-related cases, please follow the CDPH notification protocol first, but we're also working in coordination to help support you through this process. And we'll continue to provide these updates and additional information through these webinars. Next slide. Finally, DFSS is working closely with the COC and other city departments to align our COVID response and resources that are becoming available from the stimulus packages to not only address the critical needs of the crisis response system through this crisis, but also to advance the community's broader housing strategy, which All Chicago is going to be speaking about in their portion of the webinar.
Great, thanks for that segue, Maura. Hi everyone, it's Nicole Bahina with All Chicago. So I'm going to be talking about, or we have been talking about, All Chicago's work to support the system in 4 different buckets. And so today we'll kind of bring you up to speed on some of these buckets. And I think we should be able to have a good chunk, maybe 15 or 20 minutes at the end for questions. So we'll pause and do all of the questions at the end. Next slide. Okay, great. So if you have not already joined our Slack.com channel, please do. If you're not active, please consider finding a way to be more active. For me, that meant that I needed to leave the browser open while I was at my desk and then also download the app on my phone so that I can see notifications that are coming across. And I promise that if you take the time to do this, you will see the benefits, and hopefully you can share some of the information as you're uncovering it as well. So we know that in times of crisis, information sharing happens fast and furiously, and this is the primary way we are hoping that to not bombard people with emails, but to put as much information as we can in there. And we do have staff at All Chicago who are watching everything that's happening in Slack and trying to redirect or direct people in the right way. And Jennifer just pasted into the chat a link that you can use to sign up to join Slack. Next slide. Okay, so when we talk about helping maximize financial resources for agencies in their response to COVID-19, one of the things we're doing is running a process. It's round 2 of our agency emergency fund. So there is one clarification that's not on the slide that I think I was watching some of the chats and we've gotten some questions on today that I just wanted to provide clarity on. In round one of the agency emergency fund, we were using both those IDHS funds that Maura talked about earlier in the presentation, combined with some flexible private philanthropy. Now that we're redirecting those IDHS funds, this round is only flexible funding. So that means that there are less strings attached to it, and we've provided a little bit, hopefully better of an application experience this time around that'll help us make decisions quicker and still be streamlined for you. So we opened up the second round of applications today. We're anticipating that awards will range around 10 to 15,000. That doesn't mean you can't ask for more, but that's what we anticipated and what happened during round one. We can cover costs incurred from March 16th to May 1st, and the applications are due May 1st. This is a quick turnaround. I think that's next Friday. And, you know, we want to do that because we want to get the funds out quickly. The goals for round two are to support homeless service agencies that are providing services in neighborhoods that have been disproportionately impacted by COVID-19. And for you to be eligible to apply, you need to be a nonprofit agency in Chicago, have a track record of robust programming and services for Chicago residents experiencing homelessness, and you must be currently operating a program to support those households experiencing homelessness. Next slide. Okay, so I think I have a double eligibility criteria there. Sorry about that. But the eligible costs are for staffing, supplies, temporary housing, facility, or other. So if you know you have some other costs that you have incurred due to COVID-19, you know, basically anything can fall into that other category. Next slide. So like we mentioned, applications are due Friday, May 1st at 5 p.m., and we anticipate funding notifications to go out the week of May 11th. Please only submit one application per agency, and the link is on our website. It looks like Jennifer has posted more information about or the link to our website where you can access more information and then get to the online application portion. Next slide. One other sort of bucket of work that we're doing within this maximizing financial resources for agencies is trying to help the HUD Continuum of Care funded agencies stay up to date on anything that relates to their their grants from HUD. So we wanted to make sure people are aware that HUD is allowing grant amendments to the FY 2018 executed grant agreements to meet immediate client health and safety needs. They're going to release guidance on FY 2019 grants soon, and we'll paste a link in the chat if we haven't already to download the package that you can follow related to being able to do this. And of course, at any time, if you need assistance, you can email us at cocprograms@allchicago.org, and we're happy to help troubleshoot as you go. Also, a couple of resources that might be helpful for you, especially as you're thinking about whether you need to make grant amendments. HUD published, over on the right-hand side of your screen here, you'll see it, back in March, an outline of what Continuum of Care program funds could be used for in terms of infectious disease preparedness and response. So it might be helpful to look at that while you're thinking about whether you need to do a grant amendment. And then if you have questions that you don't want to come to All Chicago for, or you just want a different kind of response, I would recommend joining office hours. HUD has them every Friday. We send All Chicago staff, but if you want to join and ask questions as well, we would recommend that you do that. Okay, so let's move on to talk about the work that falls under the action agenda. So just as a reminder, the action agenda is the way that we are implementing our plan to end homelessness in Chicago. The Continuum of Care Board is at the top here. All Chicago and DFSS help support the work through 12 lines that are shown here. And so if you want to go to the next slide, I can talk a little bit about the Expedited Housing Initiative that we released earlier this week. And the reason it's important that I wanted to first show the lines of action is because this Expedited Housing Initiative is being administered and sort of run through all of the lines of action. And so you might be part of like the Coordinated Entry Leadership Group, and if you are, you're going to be talking about this at your meeting on Tuesday. So this is you're going to be hearing more and more about this Expedited Housing Initiative, especially if you're involved in the action agenda. So the COC board adopted a policy that supports this expedited housing initiative at their April 15th meeting, and the policy will go into effect soon. If you want to go to the next slide, can share a little bit more about what was passed in that policy. So the policy states that providers must actively work and demonstrate their efforts to expedite housing placements. It says providers must remove any barriers that impede rapid placement of participants into housing, and that it also allows for the continuum to set aside existing coordinated entry prioritization or come up with a new prioritization so that the system can remain nimble and responsive to those needs of the most vulnerable as it might be shifting in light of COVID-19. So I will say that one of the action agenda lines of work committees, SPEC, met yesterday and approved an accountability plan. So I don't have this on the slide here, but there has been an accountability plan that is going to be released on Monday, just showing sort of the expectations and how we're going to be helping hold agencies accountable on behalf of the continuum of care to the fact that we're moving people in quickly, that we're not putting up additional barriers. So, you know, many agencies are already able to demonstrate the efforts that you've gone through to help keep moving people into housing, and we just want to make sure we're bringing everybody up to speed on that. But we know that providers should not be expected to do this alone, and that's where our next steps come in at All Chicago. So we're going to be working with CSH to help change coordinated entry prioritization and expedite any matching processes that are needed. We are going to be talking about later today system-wide landlord engagement, and you'll see a lot of information coming out about that if you haven't already. We'll be helping increase the flexibility and usage of bridge housing and rapid rehousing. So people might move into bridge and rapid rehousing as they're waiting to get into permanent supportive housing. So we're exploring how many people we can do that for and how to utilize all of the resources coming from the stimulus package to do that. And then we're going to be supporting efforts to reduce system-wide barriers to housing. So while providers are sort of looking at your own house to see what you could do to expedite housing placements, we're also going to be asking some of the funders where we know barriers exist, like there's typically some issues with CHA and the Low Income Housing Trust Fund, or you might have funding restrictions from the state. And so we're going to be working with all of those entities to see what waivers they can issue during this COVID-19 crisis to make it easier to house people more quickly. Next slide. So some next steps for providers, and these are not different than what we're seeing in the brief. So if you read the brief that went out earlier this week, you know, nothing new here, but we're hoping everybody can think about applying for HUD waivers and implementing emergency record keeping protocols. There is guidance on our website about what that means and how to go around and use alternative forms of ID and things like that. So we'll be following up with agencies where we know there's been like a coordinated entry match made, but maybe it's kind of been lingering for a little bit, just to see how we can help move things along more quickly. We're hoping that providers can start tracking and documenting the updates that your agency is making to its internal procedures to align with this expedited housing guidance. We would ask that people find time to convene a virtual internal committee at your organization to outline the flow of how people get into permanent housing and see if there are ways that the process can be expedited or changed. And especially as you're learning more and we share more about what centralized landlord engagement means, it might change your process significantly. So we'll make sure to talk about that at future webinars so that you can keep updating your processes and see how it might impact those. And then if you have any extra capacity for staff to redirect efforts towards centralized engagements, either landlords or helping get people housed, you know, please let us know. We'll be doing a more official call out for help once we know more. And then please find a way to get involved in the COC action agenda. So we can put a link to the action agenda on our website in the chat so that you can find a way to get involved. It's the primary way you'll be able to influence how this expedited housing initiative rolls out. Okay, next slide. Oh, I do have a slide about this. Thank you. The System Performance and Evaluation Committee is within the System Performance Data and Research line of action, and they did review an accountability plan, and more information will be coming next week. Great, and then that coordinated landlord engagement strategy that I mentioned a couple of times before, I just wanted to provide a little bit more information about this. So our coordinated landlord outreach right now involves doing phone outreach, having an online landlord survey, and a centralized housing availability list. So if you have a housing locator at your agency, we would ask that they plug into this effort and figure out how they can both benefit from it but also contribute to it. And to do that, you can email Melanie Felt, so mfelt@allchicago.org, to get involved. And just as a little plug, what's in it for me, centralized landlord resources equals more and better options for the whole system. So we're really going to be honing in on how the centralized landlord engagement strategy can benefit everybody. We are also working really hard to identify resources so that we can implement landlord incentives. So again, if you're able to plug into this effort, you could benefit by having access to Landlord Risk Mitigation Fund. We potentially have a funding source for this, but we know it won't be enough, so we're just working diligently to try to secure enough funds for it to be worth something, and then holding fees. So those are the two things that we know could hinder our ability to house people quickly and rapidly, and so we're trying to work to address those. And then we are working to develop a process to move people into units quickly. So we're creating structured processes to inform roles and communications between housing locator staff, landlords, staff that are moving participants into housing, and the participants themselves. So we'll have lots more information coming on that. Great, and these next two slides we can go through pretty quickly, Torlin. You'll have them in the packet that'll go out in Slack, and DFSS and CDPH and All Chicago will remain vigilant in communicating on our weekly joint webinars, but please make sure that these communications and this information is circulated to relevant staff so that everyone has the latest information. And with that, I think we'll pause and start to get through some questions. Maura, do you have some that you think you want to start while I review some of the others that are directed toward All Chicago? Maura, if you're talking, I think you might be on mute.
Okay, I think I'm back on. So there's a question around who will be providing the masks to CTA riders who are experiencing homelessness. So outreach providers who are conducting outreach on the CTA have received masks to distribute to clients that they're engaging on CTA, and we're continuing to place orders to keep that supply available as needed. There's a question about if DFSS can speak to the problem of getting homelessness prevention assistance through 311. Is there another avenue to address this problem? I don't have enough information about this problem, so feel free to share this concern through the DFSS homeless email, and then I think also encourage you to speak with the Catholic Charities team, since they manage the homelessness prevention call center, and we can work together to see if we can understand the issue and propose some solutions. There's a question about whether there have been additional shelter beds added on the south side of Chicago. Yes, we opened the Kroc Center, which is in the Roseland community for women and soon-to-be families. Most of the additional shelter beds have been added through partners that came to the city with available space, like the YMCA and Salvation Army. So this in the midst of the crisis, the locations were largely identified by rapid access to facility locations. But as I mentioned, there are going to need to be some, as we talk about recovery and post-COVID response and what the guidance for social distancing means beyond the stay-at-home order. As a community, we'll be needing to have conversations about what this means for shelter beds and shelter locations, and we'll need to have a community-wide planning process around that. I think, as everyone knows, it is really hard to open shelters and convince communities in all parts of the city, that shelters are needed and have a place in all of our communities. So as we go through that, that process, we'll be needing to work together. There's also a question about what efforts have been made to engage Southside providers in the planning process. And I can speak to from the DFSS side and on our shelter decompression efforts, and then maybe Nicole, you can talk about, as we move into the broader permanent housing and recovering strategy. One of the reasons that we felt it was really important to get nurses and staffing to support the shelter community in all of our areas of the city was to really understand the specific needs our partners are experiencing. And so they have, we are considering this part of, essentially a bit of a needs assessment and a planning process. So for all of the sites that they visited, they've completed, took all of your information, took the needs that you've expressed having, and are putting them into a report. And so we will be looking at next steps to work in partnership with providers. So we will be reaching out to you to talk about what those needs are, and if they are community based, we can do it in that way as well. And Nicole, I don't know if you want to talk to in the engagement of Southside providers in the housing strategy recovery process.
Yeah, I mean, I think the full plan is not yet hashed out and or funded, and so we're not quite very far along in the actual operational planning process or thinking through this. But like I mentioned before, we're going to try to run as much of this through the action agenda structure. And so if I'm still a little bit new in my position, I'll be able to blame things on that for at least a year, right? But if we feel like that as a community that is not a strong enough place and that we need to do additional outreach outside of the action agenda structure or engage with the COC in a different way, please put that in the chat, because I would love to do more if we feel like that's needed. So we're totally open to what the community thinks about that.
Okay.
Hey, Nicole. Can you hear me? This is Chris.
Oh, yeah, Chris, you know what? We're not really, just to be fair to everyone, we're not opening up the lines for questions. But I know you don't have access to a computer to be able to put it in the chat. Do you have something quick?
Yes, it's very quick. I know a lot of people are talking about community block grants, but you guys thought about what community service block grants would do and who that would be funded through and how they would coordinate with the ESG and the CLC?
I can speak to that. So the community services block grants come through the city. So that will be part of the broader city stimulus funding planning. All Chicago and the COC, along with some other advocates, have submitted recommendations to the city. So all of those are being looked at to help us advance this housing strategy. And additional crisis response needs as well.
I can email a list out, Chris, to you if you want. There's a great resource that CSH published. It's a national resource that just talks about all of the new stimulus funding and what it might be able to cover as it relates to housing and homelessness. So I can send that to you. And I can put a link in the chat too for anyone else that's interested.
I want to acknowledge a few questions that we are going to have to add as a follow-up because they relate to CDPH. So there's questions around whether testing will be happening in transitional housing sites. So I would like to get that answer from CDPH. I know they've been characterizing, congregate facilities, so it includes shelters and it does include some transitional programs, but we want to get some clarity on that for you. There's another question about who is facilitating and overseeing kind of the release and return of incarcerated individuals, especially those who have behavioral health needs and lack of housing resources needed for DOC release. And I think we'll need to do some additional follow-up on that. There are point people on the Cook County Sheriff side of things. There's work happening with the Mayor's Office of Public Safety, and then there are other service providers that are involved, and I would like to get you a more detailed answer to that question. And then finally, on our end, there's a question about people leaving shelter during the day and needing a doctor's note to return. We've continued, and CDPH has continued to indicate that, during the stay-at-home order, shelters and people living in shelters, need to follow those that order in the same way that all of us do. So that does mean that people are able to leave the shelter during the day if they need to go out for essential reasons, like doctor's appointments or jobs, or doing laundry or getting basic needs met. And so, this is a question that continues to come up, and I know some of you are experiencing challenges with this. And so we will continue to work with CDPH to see if there's more specific guidance that we can give on that. But at this point in time, I'm not aware that there's a requirement to have a doctor's note to return. I think that's it for DFSS, Nicole.
Great, thanks. And just to add on to that, I was reviewing while Dr. Jasmine, when she mentioned that CDC had published updated guidance for homeless service providers. I'm not sure if the original guidance did say this or not, but it does now say that homeless service providers are encouraged to not require any type of negative documentation or negative test documentation to enter back into any homeless or housing program. So, and this says unless directed otherwise by state officials, and I don't think there is additional guidance on that. So, okay, so some of the questions that were directed at the portion that I spoke about today, someone asked if you were funded in the first round of the agency emergency fund for COVID-19. Are you prevented from participating in the second round? And the answer is no. So agencies that were awarded can apply again. So there isn't a rule about that. And you do not need to be a COC member in order to apply. So we do hope that and require, at least in the eligibility criteria, it states that agencies must be operating a program that is in the continuum of care written standards. So those are typically programs like emergency shelter, permanent supportive housing, and things like that. But we do recognize that there are agencies doing that amazing work that are not yet COC members. Additionally, there's a lot of COC members who are just not up to date on their dues yet, and we didn't want to exclude anybody from that. Someone asked if CHA was part of this expedited housing initiative and said, especially for project-based programs that have openings. And I would like to say that, we are actively working with CHA to make any recommendations and adjustments, and we're also actively monitoring which programs have matches from coordinated entry but are kind of like lingering because of some sort of rule or process, and then we're using that to bring it back to either the agency or the entity that might have the rules that are making it difficult. Mary Howard at CHA and Carrie Steinbuck have both been very responsive. Mary Howard is a COC board member, and so they are actively involved in in our efforts, and realize that they also are going to be needing to make adjustments as it relates to this. So hopefully more information will come out soon about that. So someone asked, will agencies be negatively impacted should a landlord not be willing to waive documentation requirements? No. So I think we would just be asking people to document the due diligence and the attempts to engage that landlord in a different way. And we also realize that this is one of the reasons why a centralized landlord engagement push is necessary. So we're trying to get, like a letter from the mayor, which has been really successful in the past at convincing landlords to take a risk on this population. We also know that those mitigation funds or incentives for landlords can help them make that jump. And so we're going to be, trying to help bust through that barrier as much as possible. Stephanie Seidman, if you're on, I could find you. Somebody is asking about whether someone could become newly become a skilled assessor at this point, or do we only need existing skilled assessors? Let me see if I can. I don't know if you're able to unmute yourself or not, but let's see if I can find you. Okay, Stephanie, are you there? Okay, you might have called in and I don't have the number up to find you in the chat, so maybe you could respond in the chat box too, but I'll leave you unmuted in case you can decide to chime in. So I think most people know that CSH is the lead agency that runs coordinated entry, including the skilled assessors and housing navigators, and so we're working with them on this whole entire plan. Just reading a few more. Some housing agencies have paused moving people into housing. Is there a plan to help address clients who have been waiting for housing and now have been told they have to wait? I think I might have answered that already. I think we're looking at, it doesn't matter the reason why now clients are being asked to wait, but we're looking at the numbers. So we know who has been matched, and we also know whether they've been housed or not. And so anybody who falls into that category of in waiting, we're going to be monitoring them on a daily basis to see how long it's taking, and if it goes beyond a certain threshold, which I can't remember what it is, we're going to be looking at why, and pulling information and reaching out to providers to help try to do some troubleshooting there. Great, and then I see that someone did say, reaching out to more programs on the south side would be good beyond the action agenda, and so I will take that back to my team, and we will attempt to do as much outreach and engagement as possible. So thank you for that. So yeah, thanks for the comment about a client who was matched to a CHA project-based voucher unit at the end of January. It's a difficult time, but hopefully we'll be able to help. If anyone has specific issues, feel free to email us at COC Programs. We probably already know about them, but that doesn't mean that we can't at least put another flag or get more information from your side of the story about what's happening. So that's COC Programs at allchicago.com. And to the person who said that the skilled assessor question was answered while the audio went out, I don't think the audio went out. We just didn't answer it. We asked Stephanie to put it in the chat if she's still on, and if not, we'll bring back an answer to that next time. Maura, were there any other questions that came up on the DFSS side of things?
I'm not seeing anything.
Okay. All right, well, we'll leave the chat open for a minute, and if you have a question, you can put it in, and we can always answer it next time or put an answer in Slack. And one thing I think I forgot to mention when we were talking about the accountability plan, so for all COC-funded providers, just so you know, we're going to be talking more specifically about the accountability plan at next Thursday's, I think we hold it in the afternoon. It's like the Thursday housing group that we've been convening, and Jennifer can paste in the chat box. Yeah, thanks. So Thursday, April 30th, the provider peer sharing webinar at 2:30. So please join that if you are not already a part of those. It's going to be really important to learn more about the accountability plan that was started at the COC board level and went through spec, and now we're rolling it out. So an announcement and more information will come out on Monday. You'll have time to read and review it, and then show up at that meeting prepared to discuss how we're going to do all of this together. Thanks, everyone. We will catch you next Friday.